Love that movie. Jack Nicholson may get you laughing about it. Sex, though, not exactly an easy subject for many heart patients.
And clearly Jack is not ready. He couldn't even climb one flight of stairs. Well, this morning, for the first time, the American Heart Association has guidelines on when it's safe to have sex after a heart attack. Medical correspondent Dr. Jon Lapook is with us this morning to let us know exactly what that means. I'm curious that they even felt the need to have guidelines for this.
Well, it's a subject that people really have trouble talking about.
Yeah.
More than 1 million people have heart attacks every year in America. There are almost 30 million Americans living with heart disease. So this is a big deal. And yet it's such a touchy subject for doctors.
Why?
I think people just have trouble talking about sex. And when I was in medical school, there was a man who had had a heart attack. And as he was leaving the hospital, he said to the doctor, you know, when can I resume activity? Now, he meant sex. He said activity, and the doctor sort of cavalierly said, oh, take it easy. He didn't have sex for several years.
Wow.
So, you know, it's a big deal.
So it's a big deal. We don't talk about it. So what are the new guidelines then?
Keanu Reeves was almost right. It's not one flight, it's 2 flights. It turns out it's safe for most people. If you can go up 2 flights of stairs or walk briskly without having a problem, then you're probably okay. On the other hand, if you do minimal activity and you're getting angina, now that's somebody who needs further evaluation. You have to have those symptoms under control. Now, you may say, you know, what are the odds? And I know the statistics are presented in a weird way, okay? But if 100,000 people have sex, who have had a heart attack, have sex for an hour, then 2 to 3 will either die or have a heart attack. Now, that's relatively small. It's more than if they don't have sex. Only 1 in 100,000 will die or have a heart attack if they don't have sex. But so it's 2 to 3 times more, but it's still relatively safe.
And it's for an hour.
I'm just looking at his face, Erica, holding it with a straight face, saying, if you have sex for an hour. Who are those people?
I can give you their names later if you'd like,
I'm
Gail.
just curious.
But
it's
just the way they do the statistics.
So if patients have questions, what should they do?
Okay.
You should just have a frank conversation, should you not?
Use your words. What do we tell our kids? You have to use your words, okay? You have to say the words, say exactly what's on your mind, say your fears, no embarrassment. And here's another thing, okay?
And the doctor's not laughing at you for asking the question.
No,
that's part of the problem.
So
you think the doctor's going to think,
well, you know,
sure.
And it's just a matter of making it part of the normal conversation. When I I'm an internist and gastroenterologist. Part of the review of systems, I ask every person about sex. I don't want to forget to say this.
How do you ask it? I'm curious. How do you ask the question?
How's your sex life? Any problem with dryness, orgasm, libido? Just, you know, matter of fact. And then if you're using the word, they can use the word. But I don't want to forget to say, if there's any question at all, if there ever was a subject where you have to individualize the risk, talk to your doctor. It's personalized. These are guidelines. And guess what? Sex, it's like a stress test. So if there's a question, you can go on a treadmill. You can go to a level that's a little higher than the activity you would have for sex. And the doctor's looking at your blood pressure, your pulse, your cardiogram, the actual movement of the heart. And they can say, well, there's a problem or there's not a problem. If they say it's okay on the treadmill, you're probably okay in the bedroom.
So there you go. Go on the treadmill for an hour first.
I know, Erica, I'm curious, what is the speed on the treadmill that we should be trying to attain to make it clear that it's okay?
Well, it's, you know, there's a thing called METs, metabolic equivalence, right? And, you know, they say if you get up to, say, 4 to 5, 3 to 5, then generally that's you're pretty safe.
Okay.
Jon Lapook, always good to have you with us.
Much. We did it with a straight face for the most part.
Yes,
that's good. We're grown-ups almost.
We are grown-ups.
We can talk about these things.